Samope, Sampa Dietia, Chimafidi non cotu, era one radio. Samope, Jumpa Dietia, Chimafidi non cotu, era one radio. Oh, and you pampuma, Asam pampuma.
Good evening, Era One Radio listeners. I must apologize for the glitch. We had a little bit of glitch earlier on. We were on air and we went off air and we are coming back again. So please forgive us. Well, you are still with us on Era One Radio. We are broadcasting live on Facebook, YouTube, and Modern Ghana Radio. The number to call in if you wish to join us is 2402-802-633. And if you want to text, it's 5109310946. We are broadcasting live on Facebook, YouTube, and Modern Ghana Radio. A few weeks ago, we started a topic on the role of healthcare management, and we kind of zeroed in the African continent where we selected Ghana as our case study. We wanted to do more, discuss more about the role of management when it comes to the Ghanaian economy. That is what we're going to do tonight. In TFA for Namekano, T1 say, and Imria Sensia, or one program I have to do health is well protected, no, because who are Ahodia or Ahodia necessary, Ahonia, your health, no, and a year worth. And say, Imbremene doctor or 32 on now, will be lady and discussion. But before that, no, my introduction now in Chebio on Famanaso, where would you birthday and then on a would be dinner with that, obey to me at text in a wishing Papuna. Oh, Doc, you are welcome.
Thank you, Dr. Boyson. At here for my mungina, baby, be on the chiano. In Pessameka, which but we be a chiao. And you Medina, we're going to continue about healthcare, health management. And you be dealing with it in a very specific way. So the next time, people will understand how they can build their own healthcare setup. And yet, most of the time, the government responsibilities about yearning. And I'm right. Come with the ever to us. We dealt into some areas here. So who's now at a bank now? You can even invest it there and help the countries building up. Dr. Biano will be very concerned.
All right, thank you very much, Doc. Basically, what we're going to do is we're going to dive into the management of healthcare. When we talk about managing a healthcare, we actually talking about the buildings and the people who make the whole healthcare system work. If somebody is in charge of the health system or somebody is managing the healthcare, that person or whoever it is manages the buildings that the health structure is even encompasses. And then the employees, the people who make the health system work, which is the doctors, the nurses, the clerks, those janitors, and everybody that makes the health system work, because the building alone doesn't make the health system, and just the doctors or nurses don't make the system. It's a combination of all this. So when we're talking about how a healthcare system works out, we are looking at all. And basically, when it comes to healthcare system management now, whoever is the manager or those who might not even be the doctors or nurses, they might not even be involved in direct healthcare. They are the ones who are the administrators who take care of the health system. But all put together, the boom, free to say the healthcare system, because so doctor no amba, nurses number, janitors number, clerks number, buildings no advanced hospital, building cars niya we don't have a healthcare system. So pretty much that is what we're going to discuss. We don't have too much time today because of earlier glitches and then other commitments. So I'll let Dr. Pokwa Juma lead us in the area he wants to start off in the healthcare system as far as the management is concerned. Doc, over to you.
Thank you, Dr. Boyson. Already, Dr. Boyson has summed up everything about the healthcare system. So I think we are going to take them from component to component. Now, then we see what we are going to do so that our developing countries will also be very careful in dealing with their medical setups. One important thing I'm personally pointing out to every developing country president or finance minister and say, the country cannot build all the hospitals, equip them for the community. It's very impossible. This is what, or the suggestion that maybe we want to pass it across so that they will also know it. Having built the building, the government can advertise for individual companies to come in. What do I mean by individual companies to come in? The government should look for people like nurses, doctors, and other people to come in. But it is not the government's duty to employ them. Over here in other countries, let me just say this first. I think that you follow the British way of government in our hospitals. And the problem, when the British people change their system, we are still following the old one. And since we are following the old one, we can never equip our hospitals because abandoning Nisika will be to
Okay.
What it is, say abandon born whom they know see down see what they are. The remaining, the government should let people come in and work in. People bend there some work in. Here is the way as a government here. They have to make the people have some kind of agencies in the system. They should build some kind of agencies in the system. They should have nursing agencies, other agencies, and other things. And the rich men in the country should also come in here. When you have money, you can have an agency, and maybe you can take care of the nurses agencies in the big hospital. You will pay them and do everything. All the charges, everything.
So Doc, let me be clear about this, your initial preamble, your initial statement. So you're saying that if the government build the structures, you're saying they are not responsible for hiring the employees or workers who work in the system? Is that what you're saying? Or it has to be a combination or
combination? Yes, it should be the government cannot employ all of them.
Okay.
And that is the reason why the government cannot build more hospitals or cannot even equip them well. The government cannot employ all of them. There are something that the government can use to subsidize the development of the hospital, but not to employ the nurses, employ the doctors, employ this, employ that, employ that. The government should give it to the agencies. That is why I was trying to bring this in. The government should encourage the rich people to form some kind of agencies in the system. And then you should also encourage the professional bodies to build their own agencies.
So in other words, you are talking about privatization. There should be a system of privatization where the government is not directly involved, but then agencies should be doing that.
Precisely. That's
so we don't have the government sector where the government herself, I mean, most countries use the gender here as, a descriptive now, whatever. So the government puts out the structure and leaves the hiring to the private entities, or the government itself can hire people and still have private entities also building and hiring.
That's the combination or the mixture administrative system. Here again, the doctors can say, okay, government can say, I will employ doctors for you. Then some agencies will bring their nurses there, and then the laboratories should bring their own people there. The X-ray department should also bring their own people there. The janitors should have their own people there. But this is what I'm trying to say. All these things there should be somebody behind the whole thing. That person should be either some rich guy in the community who is responsible for certain sector of the hospital. What I mean by certain sector is that maybe I have my own laboratory equipment. I will say, okay, I want to take the laboratory and mind the laboratory myself. Then somebody will also say, okay, the pharmaceutical company will say, okay, we also take the pharmacy section to monitor. The government has no right to come, not that the government has no right. The government will not employ any pharmacists to come there. They have to bring their own pharmacists.
Let's take a hypothetical example. Let's use Korle Bu Teaching Hospital as an entity. How is that supposed to be run?
Okay, the Korle Bu Hospital, for instance, is a general or a national hospital. It's like a national hospital back here that window. The national hospital is run by partially not the government, but the health institutions.
Okay.
You see how
The
it is, because
Ministry of
the
Health.
National Hospital is made up of nurses group, medical team, the medical specialties, all kinds of these categories. But some of the categories are being employed by the government, others are not for the government. It's manned by the management.
Okay.
The management at the National Hospital, maybe they have the link with the government, but the government is not directly supervising them.
That.
They are there to make sure that all the agencies that are working there are doing the work according to what they have to do by the policies, that the government will not intervene and say that you are not doing the right thing. So they are there to guide them. And I remember that there are two agencies there. We have the management agency and the financial agencies also.
Okay.
But let's go back to a small hospital. Let me use a small hospital. For instance, if you have, let's say, a TBA hospital back at home, a TBA hospital have a ward where they admit people there. They have a laboratory, and they have all kinds of things there. They have a place like janitorial, and then they have a place of this, mortuary, and all kinds of places. The laboratory is also inclusive there. These small entities are owned by some families. But a typical place would be in Koko Holy Child Hospital. All these small sectors are owned by families. So when anything spoils there, the family comes there to equip it. So if anybody is admitted there, the payment that is being paid goes to the finance. The finance will take the money for the admission period and give it to the family. So the family is solely responsible for everything in the admission ward.
So they set up the cost of healthcare.
Yes. So they are supporting everything in that room,
the hospital, the clinic.
The clinic there. And then when you come to the clinic itself, where the doctors do their talking to the patients, it is also monitored by the hospital team, the team of the medical doctors and nurses. Again, the doctors come from a certain entity. They also come from an agency. The agency, they come, they charge, they pay them, they pay the doctors. So when they pay the doctors, the patient has the right to ask any question that he needed to ask from the doctors. And the doctors also have to explain everything to the patient. On the other hand, each one is responsible for each one. Okay. Unlike the doctor being employed by the government, you come there, you can't even ask the doctor any question because he knows it. He thinks he knows better than you. He's telling you what you have to do. No, that is not how it works. It should be like this. We have the government. All the government does is that collects taxes from them. The hospital people have their doctors. The doctors have been employed from somewhere. The nurses come from a certain entity, a certain company brings the nurses in. And then the security guards, they have their own company that brings them in there. But the management bring all of them together to make sure that the hospital is functioning well. And in the building that they are in, each person who goes there pays a little bit against the hospital. That is what the government will get because the government built it for them. And in addition to that, the government will tax any work that is going on in the hospital. So the government will actually getting money from them, and then, if possible, supporting them when the building is getting. I mean, there's some renovation or anything. Yeah, renovation with the government. So the government cannot, for no reason, employ all the people. He has no money to do that. Where is the government going to get the money to do that? It is the individuals who should come together. Let's say we are going to, for instance, the carpenters or the mechanics or the welders in the country can decide. Some of them will form a company and they say that we are going to build beds for the hospital. And then the seamstresses in the community can also come together and say, we're also going to provide gowns. And then other company will say, okay, we're also going to provide mattresses. The other company will say, we're going to prepare, let's say, bed sheets. And then, and so forth and so forth. So all these companies will make sure they provide the hospital every time. So it becomes a broadened or a privatized country where each and every person is doing something against or for the hospital. That also opens up jobs.
Okay.
Unlike if you say that it's for the government will say that, okay, I'm going to employ a doctor. Only one doctor will come to this place because I have no money to employ a lot of doctors. So the nurses, I cannot employ a lot of nurses into the hospital. Janitarians, you have only one janitorial who will be cleaning the whole of that big hospital because the government has no money. But when the companies are doing their own thing, and the resources that come to the hospital is used to pay them, they will function well.
Yeah, I think we really have to do some research and go into how these hospitals and clinics operate in a place like Ghana. Because, for instance, if you do a vis-a-vis kind of comparison with what happens there and then that of Canada, where you can brag of healthcare for all, or the citizenry enjoy a lot of free healthcare. I mean, to some extent. And then if you compare that to what operates in Ghana, then we have to come to a point where we really understand the way it operates. Because even if you take a place like Korle Bu, where it's, I would say, 80-90% of government operation, even if they take agents to work, those agencies themselves will be paid by the government. And then the agents' owners would then pay the employees that they are bringing on board. So eventually everything falls on the government. So the government exacts the tax or money from the patients and then uses some to pay the workers who are under agents. So eventually it's the government who is paying them, unless we have a place like, let's say, Nyaho Clinic, which I would say maybe is a private entity. The doctor, whoever is in charge of that place, if it's Dr. Nyaho as the owner and entrepreneur, he collects the health costs from the patients directly. And so he has total autonomy over how it operates. But then the government institute is a little bit different. So it's something that we have to look at how totally that works.
Now, this one that I'm talking about, a typical example is at the Catholic hospitals in the country. Okay. When you go to the Catholic hospital, you see that everything is going on, but the components are not owned by the Catholic
government.
The Catholic health system. Okay. The Catholic health system is responsible for citing and maybe supporting the hospital, but payment to the staff and other things, no. Supplying of goods, no. They have divided their hospital departments into families. There are certain families all over the world. Let's say the woman family all over the world. They are responsible for the women and then everything about the women health over there. And then the men are responsible for, I'm using this as an illustration. The men are responsible for everything about the men there. And then the specialities, some people who are, let's say the people outside the country who are laboratory technicians and other things, come together and they also support the laboratory. So they do everything for the laboratory. They equip the laboratory, and then every income that comes, they use some of the money to pay them, and then pay them for during their pension and other things. So here is a way that a hospital should be mined. You cannot build a hospital. Let me go back again and explain this. You cannot build a hospital, or the government cannot build a hospital and saying that I can equip the whole hospital. You cannot. If that should be the case, then you are going to build it gradually, and it's going to take you a lengthy period of time to get it equipped.
So that's where stakeholders come in.
The stakeholders should come in. The stakeholders should come in a very special way. They come and say, okay, we are going to take this. We are going to take this. You are going to take this. Then if the stakeholders come together and they fill the whole hospital, they can ask the government for administrative
support or something.
Support. So the government can give them administrative support and probably financial support, who will mind them for it. But here again, because it was the resources were contributed by the people will have eye on the way the system works. And the system will work more efficient than if it were all in the hands of the government.
So would you say an institution, a hospital, a clinic, owned by the private individuals will be better managed than that managed by the government?
Of course, you can see that. Not even in Ghana alone. When you go to all other, even in the United States here, the government hospitals are mined, but the private hospitals are more mined, more cared by the government hospitals. We go to the government hospital, the people working there, They know that they are working for the government. They do lights and they turn like this and that. But when they are working for the individual who is monitoring them, the individual knows that when he runs short of something, it's going to affect him. He's more particular with his people, but not the government work. And this is something that has affected Africa because we all took that, we all thought that the government should provide the hospital. That was what our colonial masters told us. And that's what they came to do for us. It is not so. There are some people who are wealthy in the country who can pick a section of the hospital and make it a family business to provide the resources for that particular unit that they have taken. And the negotiation with the administration is everybody who comes there, all the charges that you charge on this specific thing should be paid into this coffers so that you continue to replenish it when it expires. And the family will get job to do. The entire family will have job to do.
All right. I think today we don't have too much time, so we're just going to touch on the surface, and then when we meet next time, we'll go deeper. But let me ask this question, because if you look at the United States system, the hospital or the clinics that the presidency use is pretty much what used to be the neighbor hospital in Bethesda, now Walter Reed, where I used to work for a while before I moved. Every president visits that hospital. That is where the trusted hospital where they could go for their annual checkup. If there's anything, I remember when Trump went through COVID, that's where he was housed and all that. But then when you take Ghana, can we say 37 hospitals still the presidential hospital, or it's changed?
I've never seen anybody being sent there of late, but because whatever I hear is that anybody who is sick, they fly him out. So right now there's one that they have built attached to the School of Medical Science in
Legon. Okay.
Yeah, but what probably you see the reason why we are not getting everything right now is that everything is in the chest of the government. Everything, even the single needle that needed to be used to inject somebody, they have to get it from the government, and things are not right there. I believe from what we are doing now, we probably have to break things down so that people will know that they can even have it. They can buy shares. They can buy shares for that hospital, and then the money could be used to develop the hospital so that they will also be part of the hospital, rather than allowing the government to buy all the nitty-gritty of the hospital.
Well, I think we have a problem, because if a nation cannot develop its healthcare system in such a way that any major issue warrants the big dogs, the big shots being flown outside for treatment, then where lies our faith in the fact that we are trying to groom a health system where we are telling our people to go for healthcare, but then those who are in the helm of affairs, anytime they are sick, they look down on the healthcare system and say, oh, let me go to UK, let me go to US, let me go to Tech, let me go to other countries where there are experts there, or there are specialists there, or they have a better health system, which means we don't even trust in the whole system. I think we need to come to a point where we are fielding the clinical hospital with knowledgeable, because I know there are people, doctors who have finished medical school and they are really experts and know what they are doing. But for some reason, I don't know whether it's lack of equipment or whether for some reason they cannot, probably because I hear of a story of a lady who was supposed to be undergoing some surgery, and they told her the equipment that we need to operate on you is not here. So your last bet is to be flown outside. So I don't know why in this 21st century, we still have that problem going on. Like I said, today is just, glossing over the main stuff. We'll be going into depths about that, but maybe before we end our show, because of time, you have other comment, just, close us on how to deal with this issue where our leaders wouldn't actually spend money and time to perfect our system, if there's anything like that, but rather at the minute of any sickness, they have to leave, and then leave the masses to just use the one that is local. I mean, I don't get it.
So the point here is that there are certain institutions like the military hospital, which is owned by the government, under the military. So that one is very special. But what we are saying, what we are trying to bring it out is that the government alone cannot keep the hospitals. If he tries to do it, he cannot fulfill it to the best and to the best supervision that can meet the need of the people. But when there are some people in the community who are rich enough to involve themselves in the government, in the building that the government have put down, and then the equipment that the government want to equip, they can equip it, the government, these private people can help to equip it. So they can be an eye or monitor the application of things in that hospital so it can meet the need of the people. That is what we have to do now.
All right.
And then we are going to delve into this thing and make sure that we can make them understand that at least if they can't do anything at all, if you use one hospital and make it as a model and allow people to equip it, and let's see how it is functioning vis-a-vis what the government has done.
All right. Thank you very much, Dr. Ernest Opoku Agyeman. He's the one that you just heard. We've been trying to look at the role of healthcare management specifically in Ghana. Tonight, we just try to scratch the surface. We'll be coming back another time and go deeper and, go through the roots of some of the problems that exist now. So pretty much, I know we didn't have too much time to talk tonight, but I just wanted to give you a little bit of, a summary of what we intend doing in the next coming. Maybe, Doc, do you have any closing remarks before we leave? I know your time is gone 2 minutes past.
Yeah, thank you all for paying attention to our discussion. It's a little bit complex, and you see us, going back and forth with what we are telling you. But it's a problem that we want to resolve in Ghana or any other African countries or who is also having this same similar problem. It is true that the government has to provide hospitals for the people, but we know that it is not the government alone that can do that. This again, if we allow the community to come in to help, it will create a whole lot of job for the people in the community to get and do. So I pray that anytime that we come to, please get your pen, or if you're a minister or if you are anybody in the government system, take time and listen to what we are saying, and then put the information that we are saying in your meetings, discuss it well. If you can't use it now, please plan it with it, and it will work. Because there are some people in your community who have money. They can help more than what the government is doing. And if they help, they will be also responsible, and they will open more avenues for people to get jobs in the hospital, rather than getting these country people to do the job. When people go there, they will be there. Even emergency cases can be there for more than 3-4 days. Nobody will talk to them. So that is what I have for you all today.
All right. Thank you very much, Doc. On that note, we'll bring our program to a halt. We'll draw the curtains tonight because of Doc's commitment and other things that needs to be done. So we'll see you next time. Probably next week, we'll come back with full speed and make sure we are doing justice to the topic. We are going deeper and getting all the information. Well, until we meet again, thanks to Dr. Ostus, our CEO, our studio manager, for making this possible. Thanks to all our listeners. Go back to YouTube, Facebook, and pull our clips. We have a lot of videos there that you can watch and educate yourself. Era One is a 24/7 program. We are here every day from Monday through Sunday. I'll catch you again. Stay blessed and see you next time. Bye-bye.
Sampadiatia, Chimafidi non kotu, Era One Radio. Samupe, Jumpadiatia, Chimafidi non kotu, Era One Radio. Oh, and Yumpamchima, Chimtu, Asampamchima. Era One,
They are 4 women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard